Hello, my name is Lacey Henley, and I'm going to talk to you about the poor health crisis in the United States. Obesity is when a person takes in more calories than he or she burns through their normal daily activities and exercise. Obesity is very common and can be several years or be lifelong. There are more than 3 million cases per year in the United States. It is not simply a matter of overindulgence or a lack of their self-control. Obesity is not a disease of willpower. It is a biological problem. It is also a chronic disease. It occurs when excessive amounts of body fat affects a person's overall health. A healthcare provider can diagnose a patient with obesity if their body mass index, also referred to as BMI, is 30 or greater. BMI is a value that is derived from the weight and height of an individual. A normal BMI range is from 20 to 25. Morbid obesity can be diagnosed when a person has a BMI of 40 or greater. People can also be diagnosed with morbid obesity if their BMI is 35. If they are also experience health complications like high blood pressure or diabetes. There is no lab test, blood screening, or other diagnostic used to diagnose obesity. Obesity has become a major public health crisis in the United States. This medical condition involves having excessive amounts of body fat that increases the likelihood of various diseases and conditions, mainly cardiovascular diseases, high blood pressure, type 2 diabetes, obstructive sleep apnea, certain types of cancer, osteoarthritis, and depression. It causes about 1 in 5 deaths in the United States each year. The financial cost of obesity is higher compared to people of normal weight. The cost of treating the diseases associated with obesity and overweight individuals are estimated to account for more than 20.6% of total United States health expenditures. The prevalence of individuals being obese or overweight has increased so fast over the recent decades that the public health professionals are calling it an epidemic. The health risks caused by being overweight and obese have threatened to reverse a lot of the improvements in public health that were achieved in the 20th century. Nearly 40% of all adults over the age of 20 in the United States, which is about 93.3 million people, are currently obese. According to data published in JAMA in 2018, every state in the United States has more than 20% of adults with obesity. According to the CDC, this is a significant increase since 1985, when no state had an obesity rate higher than 15%. However, there are certain states that have higher rates than others. There are more obese people living in the South, about 32.4%, and the Midwest, about 32.3%, than any other part of the country. There are significant racial differences in the prevalence of overweight among women. About 80.6% of Black women are overweight compared to white women, which is 64.6%. Among American men, it is reversed. Black men are 70.6% and white men are 75.2%. The risk of health effects of overweight and obesity are marked less than among blacks. The risk of excess weight are known to be higher among Asian populations, so BMI cutoffs are lower for them. Due to insignificant data, it has not been possible to calculate ideal weights for other ethnic groups, which includes Mexican Americans. Socioeconomic statuses has a significant influences on the prevalence of obesity. College graduates of both sexes are thinner than men and women with fewer years of education. A wide range of government policies and programs have been implemented, including the development of national clinical guidelines, nutrition labeling on packaging foods, education and social marketing efforts, and more recently, calorie labeling on restaurant menus, and federal efforts to increase access and financing for fresh fruits and vegetables. However, most of these efforts focus on clinical and educational factors or on community interventions until recently, have rarely addressed environmental drivers for obesity. Symptoms of obesity are above average body weight, trouble sleeping, sleep apnea, which is a condition in which breathing is irregular and periodically stops during sleep. Varicose veins, skin problems caused by moisture that accumulates in the folds of your skin, gallstones, osteoarthritis in weight-bearing joints, especially the knees. However, there are treatments to obesity. Lifestyle changes, such as increasing exercise or diet. Alternatives are the mainstay of treatment. Surgery is very occasional, recommended, and most common. Bariatric surgery procedures are gastric bypass, sleeve gastrotomy, gastroplasty, laparoscopic adjustable gastric banding, biliopancreatic diverse with duodenal switch. Scientific and other factors that cause obesity include genetics, psychological influences, eating disorders, a sedentary lifestyle, weight history, pregnancy, drugs like steroids, hormones, and drugs used to treat psychiatric conditions, increased consumption of processed foods and sugar-sweetened beverages, and other medical conditions. Age is also a factor. Diet and nutrition is very important. More fruits and vegetables, whole grains, low-fat milk and dairy products, less refined grains, added sugar, salt, cholesterol, saturated and trans fats are very important. Other ways to help with obesity is physical activity and health. Exercise promotes health independent of weight control. Weight control works best when healthy eating is combined with physical activity. Studies show physical activity and health are also major factors in obesity. Exercise promotes health independent of weight control. Weight control works best when healthy eating is combined with physical activity. Studies have shown and have demonstrated that people who are more physically active live longer. Exercise helps prevent heart disease, high blood pressure, and harmful cholesterol levels, diabetes, and some other forms of cancer. Exercise clearly protects against cardiovascular disease. Physical activity reduces colon and breast cancer risk. Type 2 diabetes is related to weight gain in adults. But how do we promote physical activity? So remove environmental barriers and provide places to exercise. Suburban lifestyle is to drive everywhere. Add sidewalks, walking trails, bike paths. Increase physical activity and reduce BMI and blood pressure. Develop habits of exercise in children and adolescents. Physical education classes should focus on activities that can be practiced throughout one's lifetime. There are also weight loss drugs that can help with the obesity crisis. Fen-phen had to be removed from the market because it caused heart valve problems and pulmonary tension. However, Beliquid, which works by activating a part of the brain that controls hunger. Quercema is a combination of an appetite suppressant and a drug use to treat epilepsy and migraines. Orlistat works by inhibiting the absorption of dietary fats. All of these methods are very important. Physical activity and a healthy lifestyle by nutrition and maintaining portion control can help with obesity and overweight and poor health overall to help us live longer and have a healthier lifestyle. Thank you.